Picture this for a moment. A small-town hospital that's been hanging on by a thread finally gets the funding it needs to keep its doors open. A rural clinic that once had a 6-month wait list can now hire doctors, expand services, and save lives. An ambulance no longer has to drive an extra hour because the nearest emergency room shut down. This isn't a campaign promise. This isn't speculation. This is happening right now. In a move that's sending shockwaves across the country, the federal government has officially approved $50 billion for rural healthcare, the largest investment in rural medical infrastructure in American history. And if you live in, care about, or depend on rural America, this is a massive win that could change everything. For decades, rural communities have been told to do more with less. Hospitals closed, doctors left, families were forced to drive hours for basic care. But this funding changes the conversation completely. We're talking about modern hospitals, expanded mental health services, better maternity care, upgraded emergency response, and real support for the communities that feed this country and keep it running. And here's the part no one is talking about enough. This money isn't just about healthcare. It's about jobs. It's about economic survival. It's about giving rural America the respect and resources it has deserved for generations. So what exactly is in this $50 billion package? Who benefits the most? When does the money actually start flowing? And how could this impact your town or someone you love? We're breaking it all down right now. And before we dive in, hit that like button to show support for rural America and help this message reach more people who need to hear it. Now let's slow this down for a second, because when people hear a number like $50 billion, it almost sounds unreal. It's so big that it can feel abstract. But this money is not abstract. It's not floating in Washington. It's not theoretical. It is real funding, already approved, and it's headed directly toward communities that for decades have been ignored, underfunded, and quietly pushed to the margins of the American healthcare system. For years, rural America has been sounding the alarm. Hospitals closing at record rates, labor and delivery units disappearing. Mental health services stretched so thin that people are left waiting months, sometimes years, for help. Emergency rooms shutting down overnight, forcing families to drive 1, 2, even 3 hours just to reach life-saving care. And through it all, rural Americans were told the same thing over and over again. There just wasn't enough money. That excuse just evaporated. This $50 billion investment represents a complete shift in how the federal government is finally choosing to treat rural healthcare. This isn't a temporary patch. This isn't a one-year grant that disappears with the next budget fight. This is a massive, long-term commitment aimed at rebuilding systems that were allowed to crumble for far too long. And here's what makes this moment so significant. Rural communities aren't asking for luxury. They're asking for basics. They're asking for doctors who stay, nurses who aren't burned out beyond recognition, clinics that don't shut their doors at 5 o'clock, hospitals that can keep their lights on and their doors open. This funding is designed to stabilize those foundations first, because without them, nothing else works. One of the biggest targets of this investment is rural hospitals that are currently operating on the edge of collapse. Many of these hospitals are the largest employers in their counties. When they close, it's not just a healthcare crisis. It's an economic disaster. Jobs disappear, families leave, local businesses suffer, entire towns start to hollow out. By stabilizing these hospitals financially, this funding doesn't just save lives, it saves communities. And it doesn't stop there. A major portion of this money is being directed toward expanding access to primary care and preventive services. That matters more than people realize. When someone can see a doctor early, problems are caught before they turn into emergencies. Diabetes gets managed. Heart disease gets monitored. Cancer gets detected sooner. That lowers long-term costs and keeps people healthier, longer. This is how you actually improve outcomes instead of just reacting to crises. Mental health care is another area where this funding could be truly transformative. Rural America has been facing a silent mental health emergency for years. Suicide rates are higher. Access to therapists and psychiatrists is limited or non-existent in many counties. This investment opens the door to expanded counseling services, telemental health programs, and community-based treatment options that meet people where they are instead of forcing them to travel impossible distances for care. Maternal health is also front and center in this plan, and that alone is historic. In many rural areas, women have been forced to give birth hours away from home because local labor and delivery units were shut down. That is dangerous. It increases risks for both mothers and babies. This funding aims to reopen and strengthen maternity services, recruit obstetric providers, and ensure that rural women aren't treated as an afterthought when it comes to childbirth. Emergency care is another critical piece of this puzzle. When seconds matter, distance can be deadly. Rural emergency departments often operate with outdated equipment and understaffed teams. This investment allows for modernization, better training, and improved coordination with emergency responders so that when someone calls 911, help actually arrives in time. But let's be very clear about something. This is not just about medicine. This is about dignity. For decades, rural Americans have been made to feel invisible. Politicians talk about them during election seasons and then move on. This funding sends a different message. It says, rural lives matter, rural families matter. Rural communities deserve the same level of care and respect as anyone living in a major city. Now, skeptics will ask the obvious question. Will this money actually reach the people who need it? That's a fair concern. We've all seen funding packages announced with big headlines that don't always deliver on their promise. But this time, the structure of the investment matters. The funding is being channeled through specific rural health programs, hospital stabilization initiatives, workforce development efforts, and infrastructure upgrades designed specifically for rural settings. This isn't a one-size-fits-all plan written for urban systems and then awkwardly applied to small towns. Workforce shortages are being addressed head-on. One of the biggest reasons rural healthcare struggles is because it's hard to recruit and retain providers. This funding supports loan repayment programs, training pipelines, and incentives that encourage doctors, nurses, and specialists to practice in rural areas and actually stay there. That stability is what allows care systems to grow instead of constantly scrambling to survive. Telehealth expansion is another game changer embedded in this investment. For rural residents, telehealth isn't a convenience, it's a lifeline. When geography makes in-person visits difficult, virtual care can bridge the gap. This funding supports broadband expansion, telehealth infrastructure, and training, so rural clinics can offer high-quality remote care without sacrificing standards. And let's talk about aging Americans for a moment. Rural communities are aging faster than urban ones. Seniors often live far from care facilities, rely on limited transportation, and manage multiple chronic conditions. This investment strengthens home health services, long-term care support, and community-based programs that allow seniors to age with dignity, instead of being forced out of their communities. What we're witnessing here is something rare in modern politics. A policy decision that recognizes a real problem, listens to the people affected, and responds at a scale that actually matches the need. $50 billion isn't symbolic. It's structural. It's the kind of investment that can reverse decades of neglect if it's implemented correctly. And here's why this moment matters so much right now. Rural America feeds this country. It fuels this country. It supplies the labor, the land, and the backbone of the U.S. economy. When rural healthcare collapses, the consequences ripple far beyond county lines. This investment strengthens the entire nation by strengthening the communities that support it. Critics may argue about spending. They always do. But the reality is simple. Failing to invest in rural healthcare costs more in the long run. It leads to preventable emergencies, higher mortality rates, and economic decline that requires even larger interventions later. This funding is not wasteful. It's preventative, it's strategic, and it's overdue. What's especially powerful about this moment is that it creates momentum. When communities see investment, hope returns. Young families are more likely to stay. Providers are more willing to commit. Local governments can plan instead of panic. That psychological shift alone can change the trajectory of entire regions. This isn't the end of the fight for rural healthcare, but it is a turning point. It proves that large-scale solutions are possible when there's political will. It proves that rural voices, when loud enough and persistent enough, can break through. If you live in a rural area, this funding could mean the difference between a hospital closing and a hospital expanding. If you have family in rural America, it could mean faster emergency care, better mental health support, and safer childbirth. And if you care about the future of this country, it means a stronger, healthier foundation moving forward. The next chapter is implementation. Accountability will matter. Oversight will matter. Communities will need to stay engaged to ensure this money is used as intended. But today, it's okay to acknowledge the win. It's okay to say that something big and positive just happened for rural America, because for once, the headlines match the reality. This is the largest federal investment in rural healthcare in American history, and it has the potential to save lives, protect communities, and rebuild trust in a system that too often failed the people who needed it most. And that's why this moment deserves attention. That's why it deserves conversation. And that's why it deserves support. If you found this breakdown helpful, if you believe rural America deserves strong healthcare, and if you want to see more coverage like this, make sure you hit that like button and stay with us as we continue to track how this historic investment unfolds.